right, well, welcome everyone. We're gonna go ahead and get started. It is 10:30. Good morning. So if you attended this morning's session on resources to help navigate through the pandemic, welcome back. And if you're just now joining us for this session of the Age Positive 2020 Revision Conference, welcome. My name is Rachel Olhausen. I'm the Program Operations Manager with Jewish Family Services of Greater Kansas City, and also a member of this year's Age Positive Planning Committee. It's my pleasure to moderate this workshop, Reframing Aging During COVID-19. Our previous sessions informed us about the prevalence and negative outcomes associated with social isolation and loneliness, as well as introduced us to innovative programs and resources that we might add to our own programmatic strategies. Our final workshop today will focus on how we can reframe our messaging and communications to provide positive views of aging. This is especially important now as ageist stereotypes and language has reemerged during this pandemic. So before I introduce our presenter for this session, a few housekeeping items. All participants will be muted and cameras will be turned off during the presentation. If you are new to Zoom, you can click or tap on your screen, and at the bottom you will see a menu appear. One of those items is the chat, and to participate in the chat, click on that speech bubble icon and a chat window will appear to the right of your screen. At the bottom of the chat window is where you will click to pose a question or to simply chat and give some feedback or comments. There will be a time for questions following the presentation. Please type your questions in the chat. I will be keeping track of those questions and relaying to the presenter. So if you have questions during the presentation as they come, go ahead and put them in there. Please also use the chat to enter comments. So it's important that we share and learn from each other during this session. And then finally, this presentation will be recorded. The recording, PowerPoint, and chat conversation will be made available within 2 weeks following this conference. And you'll receive an email announcement when these are available on the conference website. So now it is my pleasure to introduce Janine Vanderburg, Director of Changing the Narrative in Colorado. Her full bio is on the website, and we are so fortunate to have Janine here to share her vast knowledge and experience with us today. So thank you, Janine.
Rachel, thanks so much, and thanks to all of you for being here on a Friday. So Changing the Narrative is a campaign, and we're based in Colorado, to change the way that people think, talk, and act about aging and ageism. And we have the wonderful support of 2 foundations, also based in Colorado, the Next 50 Initiative and Rose Community Foundation. I have been doing a Reframing Aging workshop since January 2018 when our initiative started. I was trained by the Frameworks Institute, and one of the things that has really occurred to me in the last few months is that reframing aging is more important now than ever. So I really want to thank all of you for being here and being part of this movement to change the way people think about aging and older people. And I want to start out by hearing actually from you. So we're going to do a poll about 2 questions, and I'll give you 2 minutes to kind of complete both questions, and you can do multiple choice. And the first question is going to be, what roles do you play in the aging ecosystem? And for many of you, you may wear many hats. And the second is, what platforms do you have to communicate with? And what I mean by platforms is not just social media platforms, but do you have the opportunity to make speeches in your work? Do you have frequent meetings with friends and colleagues? Do you have access to news media? Because what we're going to be talking about today is communicating in a different way about aging. And I'd like everyone at the outset to be thinking about the multiple platforms that you might have to communicate these new messages. So we're going to go ahead and launch our poll. And there are 2 questions, so you'll want to scroll down, and I'm going to give you about 2 minutes to do that. You have about 30 seconds left, so go ahead and get those responses in. All right, it looks like not quite everyone has voted yet, so I'm going to go ahead and allow another 30 seconds and then we'll close. So if you'd go ahead and describe what kind of role you have and also what platforms you have for communicating. Okay, so we're going to go ahead and end the poll and share the results so we can see who's in the room. And now you've got an opportunity. So we've got a really diverse group here. We have people who are involved in advocacy, in communications and media, people from councils, funders. Thank you for being here. I always love to see such a high percentage of individual community advocates because we know that often it's people on the ground that can really help change language. A product developer, public policy research, lots of you, over 50% are in services, workforce volunteering, and other roles as well. And we also have really diverse platforms that we have, which is great because the essential idea of reframing is that the more people across multiple platforms are sharing very similar messages about what it means to age, the stronger presence that we can have in a community and the more that we can change the public discourse, which I can see already from your chats, you're recognizing that the public discourse about aging and older people is pretty negative. We have access to blogs, websites, lots of you in informal conversations, local national media, a great percentage there. Many of you have newsletters, you're active on social media, speeches and presentations. So we've got a lot of opportunities here. And we want to start with that because as we are going through this workshop, one of the things that I would love for all of you to think about is where can I use this message, to whom can I use this message, etc. So I am stopping sharing. And we are going to go ahead and review our agenda. So we're going to start with, this is called Reframing Aging. So why reframing aging? Why now? And why you? All of you in this room, although I suspect you know the answer to that. What is framing and why do we do it? Then we're going to talk very specifically about, at this time right now, what it's very words and messages that are very important to avoid and steer away from. And I want to give kind of what I call the trigger warning now, and also the no shame rule. So many of us have been using that language because a lot of the language and messages are very much present in popular discourse. So what we're going to be sharing are recommendations and for you to think about as you move forward, what to avoid. Then we're also going to talk about what are the messages that research has shown are effective to advance, and we'll talk a little bit about the research behind that. This is research by the Frameworks Institute, which is a Washington-based strategic communications firm, and all Frameworks does is research on how to communicate effectively about social issues, in this case, aging. And then finally, we'll conclude with what are some ideas and how do we kind of move it to action. So let's start with why do we need to reframe aging? Why now and why all of you? And I think, you know, the biggest thing that many of us have realized during the time of the pandemic is how ageism has been exposed. There are some people who believe that ageism has increased, and I don't know whether that is true or not. My friend Ashton Applewhite keeps saying the ageism has been there all along, and it's really just more of an issue that because of the circumstances surrounding COVID-19 and who it initially affected, that it's really exposed ageism. And I'll let you to decide that for yourself. We want to start with a definition of ageism. And if we can move this ahead. And ageism, this is the World Health Organization definition of ageism. There are a lot out there, but this is the one that we prefer. And it's a combination of things. It's prejudice, it's stereotyping and discrimination based on age. Prejudice are things like, I simply don't like old people. Stereotyping are remarks like, older people really are digitally incompetent and they're not willing to learn new things. And discrimination occurs when people act in an outright way based on that prejudice and stereotyping, so they don't hire people because they're older. Or in Colorado right now, we're dealing with a situation where the critical standards of care that have emerged as a result of COVID-19 basically place older people at the end of triage lines. So if we come to a situation where there's a surge and a shortage of ICU beds or ventilators, the standards that have been developed would basically move older people to the back of the triage line. I do want to note, even though this workshop is based on reframing aging and talking about ageism directed against older people, that ageism can also be directed against younger people. So if people are making remarks like entitled millennials, that would be an example of an ageist remark, a stereotyping based on age. And no matter where it occurs or against whom it occurs, ageism is a serious issue. So some people, and Frameworks Institute found that in its research, that many people didn't even know what ageism meant, which is why it's important to always define it. And they didn't understand at all the implications of it or the prevalence. So I wanted to share just a few stats with you, and there are lots of stats available. But a recent study that was released in July by the University of Michigan found that 82% of Americans between the ages of 50 and 80 experience one or more forms of ageism, what they call everyday ageism in our day-to-day lives. AARP studies have shown that 2/3 of adults aged 45 and over have either experienced or witnessed age discrimination in the workplace. And the Urban Institute had released a study at the end of 2018, I believe, that showed, and it was a longitudinal study over a period of many years following 20,000 people who entered entered their 50s with stable employment. 56% of those were pushed out or laid off because of age, and only 10% ever recouped financially. So we know that ageism is real. And why now is we've had, and I know many of you have expressed, we've had a firsthand look about how ageism has played out in a very dramatic way during the pandemic, which calls in a way for all of us to speak up and take action. So here are just a few ways that COVID-19 exposed ageism around the world. And I think many of you realize, given the roles that you have, that at first it wasn't taken seriously because COVID was, quote, an old person's disease, right? So we're not really going to think about what the public health impacts are. There were this series of what I call the hashtag horrors. So COVID-19 has been called hashtag boomer remover. It's been called hashtag grandma killer. So reflecting in a way, the ways, in many ways that the general public feels about older people. What was shocking to me was when the Texas Lieutenant Governor, Dan Patrick, first said, well, older people should just sacrifice for the economy. Generally people thought that was a pretty horrible thing to say. But then within a month, that same sentiment was being expressed by MIT economists who are publishing papers about it, and has ended up in a way making its way into public policy. So again, ageism really, whether it's surging or was already there, but those sentiments are making their way into policies that affect the work that all of us do. We know, and then for any of you who are providing direct services, certainly in long-term care facilities, we know that personal protective equipment, while it was rightly prioritized for hospitals and healthcare facilities, was not at all prioritized for nursing homes and long-term care facilities, leading to some horrific outcomes there. I've already mentioned critical care standards in many states moving older people to the back of triage lines through scoring mechanisms that basically give you points that move you to the back of the line simply because of your age, or for comorbidities, which are found more often in both older people and people of color. And then finally, we've seen the degree to which policy decisions have happened that increase social isolation. So certainly some of the restrictions around visitors to nursing homes and long-term care facilities, a particular Colorado example that has since been amended, but in the onset of COVID-19 and when the stay-at-home orders were happening, child protective workers who go and investigate child abuse cases were considered essential workers, and so were allowed to carry on their jobs. Adult protective service workers in Colorado were not. So just examples. So I think one of the things that is incumbent on all of us is to be really aware of how these ageist attitudes have played out and make sure that we are there speaking up and speaking out. So why you? Why should this group of people care about this? Well, in a way, you've kind of identified, by who you are and the work that you do, why it's important for all of us to talk about ageism and reframing aging during a time of COVID-19. But I also want to share, even without COVID-19, there are reasons why all of us who are working in some way around with older people and around aging related issues, why it's important for us to be the spokespeople for reframing aging. And I'll just share out a few stats. One, ageism costs money. Dr. Becca Levy from the Yale School of Public Health did a study last year showing $63 billion of annual healthcare costs that could be accounted for because of ageism in healthcare. And AARP, before COVID-19 started this year, released a study showing that the cost to the US economy of workplace discrimination based on age, $850 billion last year alone. And we also know that there are outcomes and demographics that I'll share on next slides. So why you? We are really the leaders that we've been waiting for. So this is a quote by a civil rights leader, Grace Lee Cobbs. But really the people who are involved in aging, in the aging ecosystem, we're all in the best position to speak up, to talk to policymakers, to talk to our friends, to talk to our colleagues, and talk to the media. And one of the things that I was so excited about when Kathy invited me to talk about at this conference and seeing, the diversity of people represented and how all of you really are leaders. So if anyone is going to speak up with a consistent message, it is all of you. And if anyone is going to speak up and be effective, it's all of you because of the platforms that you've already shared that you have. So I think many of us know what those negative outcomes are on older people related to ageism, but I thought it was important to share here. So first, obviously, if you were being pushed out of a job and experiencing workplace discrimination because of age, you experience decreased financial security, and that loss of job, if you haven't yet reached 65 yet and are eligible for Medicare, also for many people results in loss of health insurance. A range of studies from out of the Yale School of Public Health show that when we experience ageism or have negative attitudes about aging ourselves, it actually decreases our physical and mental health and also our memory. And another study by Dr. Becca Levy showed that on average, people who have negative attitudes about aging, which many of us do, right, because we're surrounded by ageism. When we have negative attitudes about ageism compared to people who have positive attitudes, we have on average a shortened lifespan, on average 7.5 years. We also know that ageism amplifies systemic health inequities. So this is a map that the New York Times had put together earlier this year that showed how COVID-19 was having a disparate impact on communities of color. And so you can see kind of the little dots here on Black communities, Latino, Asian communities, et cetera, compared to primarily white communities. But we know that ageism amplifies all of that. So if you have basically lived through a lifetime of systemic health inequities, and now you're also experiencing ageism in healthcare, the likelihood that you're going to have those much more negative outcomes as a result of COVID-19 and other things is that much greater. So, and then the final reason that all of us should care about it is, in a way, we have to be the ambassadors and the evangelists and the, the truth tellers about this fundamental demographic change that's going on. It's not just in Kansas City, and it's not just in the US, it's around the world, right? This particular graph is from the US Census Bureau. It was released last year. And we see on the left-hand side what population in the United States looked like in 1960, right? So it's kind of this tapering. We've got a whole lot of younger people moving up to a very small number of older people. This is what it looks like on the right-hand side in 2060. And we can see across 5-year lifespans, right, relatively similar population size. And that's due to a number of things. Part of it is due to advances in science and advances in public health. So people are living longer. And for the most part, many people are living healthier lives, with acknowledgement, of course, not true for all populations because of systemic health inequities. But we also know that there are declining birth rates, and that's true not only in the US and around the world. In Colorado, for example, and in many communities across the country, we don't have a replacement birth rate anymore. So what that means is that overall the population is aging, but so many of the policies, the programs, the systems that we have in place, the funding mechanisms that we have in place reflect back to a time when the population pyramid looked like that left side of the graph. And we know, for example, that funding for older adult programs, and many of you know this, you're living it, funding for older adult programs continues to shrink even as the older adult population. And we know that many funders, certainly not the funders on this call or you wouldn't be here, but many funders consider funding older adult programs to be a cost, funding children and youth programs an investment, right? So the demographics changing, the world is changing. So we need to be the ambassadors of that message. The world is changing, ageism exists, we've got to change this. Okay, so the way that we change it is framing. And what is framing? Framing is the idea of, and if any of you have been in choir, there are many voices, right? But we want to have one choir. We want to have one choir consistently giving research-based messages, not each of us talking about the way we think we should talk about aging in our work in a way that makes sense for us, but in ways that research finds actually shifts public opinion in a positive direction and shifts public opinion to realizing these fundamental ideas. The world is changing, so that graph I just showed, the world is changing. We need to change our systems and policies, and we need more funding. And we need more age-friendly policies, right? So these are all the things that we want people to understand. And the way that we can do that is through research-based messages. All of us, we showed in the platforms that we have an opportunity to talk about aging. And the more that we all use that using a consistent way, a consistent set of frames, the more likely that we are going to have the social change that we are hoping for. So framing basically means it's a set of choices about how we present information. It's what are the themes that we emphasize and that we talk about a lot? What are the themes that we avoid because we know that they actually cue up negative stereotypes about older people and about even people who work in aging, right? Very important in framing to explain. So one of the things that frameworks teaches is explain, explain, explain. We're so immersed in the issue, right? And we know how this works. So we don't explain it. We simply assert things. And I'll give some examples. And so what we've got to do in this case is we've got to use tested frames. We've got to explain how an issue works, and we always need to provide solutions. And our goal in this is we want to cue very, very specific kind of responses. Here's an example of what Frameworks calls a framing effect. And you can see here just how the change of a few words changes how people view things. So this was an example. It was a study done of free speech. And the question was, are you going to allow a hate rally to take place or a hate group to hold a political rally in your community? When it is framed as this is a free speech issue, so given the importance of free speech, would you favor allowing a hate group to hold a political rally? We can see that 85% are in favor. When instead we conjure up and we use a message that conjures up the risk of violence, we can see how support for that hate rally decreases, right? 40%. So this is an example of what framing effects are. In aging, and I'm going to talk now for 1 minute about the research behind what I'm sharing. Frameworks did a study in a series of, with a sample size of over 12,000 people across the US. And those 12,000 people were demographically representative of age, race, ethnicity, gender, socioeconomic status, and political affiliation. And what they found, and what they did first was they kind of found out what the general public thinks about aging. And I see that all of you were obviously interviewed because what you said in the chat is basically what Frameworks found. Then they tested messages, the messages that we're sharing with you today, to see which would have these outcomes. Let's talk about what those outcomes were. And all the messages that we're sharing had these outcomes. First, they changed people's attitudes about two things. They changed people's attitudes about aging and about older people. And they changed people's attitudes about this sort of us versus them. It made people realize that actually both younger people and older people, we have a lot in common, right? So that was kind of change number one. The second thing it did was it increased people's likelihood to support public policies that I know are very important to all of our work collectively, but policies that provide additional support for older people and their caregivers, policies that create more age-friendly communities, that provide opportunities for older people to tutor and mentor and give back to community, et cetera. So, and it increased people's understanding that public policies are needed for an aging society with changing demographics. And then the third thing that it did is it decreased implicit bias against older people. And we'll talk about implicit bias a little bit more, but implicit bias is basically the bias that we all have that we're not even aware of. And what Frameworks found is exposure to these messages decreased people's implicit bias against older people. So a formula that we like to think about framing aging right now is that there are three things that all of us have to do. There are things that we need to avoid. There are certain words and messages, and we're going to share those with you, that we need to avoid. On the other hand, we can't just run around and say, well, don't say this word, don't, preview, do not use the terms weak, vulnerable, elderly. That's something we want to avoid. But it's not enough to say that, because then you're like, okay, so what do we say instead? So we need to advance alternative language and research-based messages, and then we need to take action on it. If all any of us do is participate in a workshop and say, okay, well, that was interesting, or not, but we don't decide to and figure out how we're going to take action on it, we are not moving the needle and becoming that one choir. We will just continue to be many voices. But the actions that you take are very much going to be tailored to your role in the aging ecosystem that we started with, the platforms that you have, and whatever else you decide that you can do. So I'm going to just pause for a brief moment right now. And Rachel, if you can check and see if there are any questions in the chat. And Rachel, you may need to unmute yourself.
We haven't seen any questions typed in, but feel free to type in those questions, okay, and then either Janine can answer or we will keep those for at the end of the presentation.
Okay, so I'll give about 30 seconds to see if anybody has a burning question right now, and if not, I'm just going to keep going.
So Janine, you might have seen this. We had one question of why is there more ageism in some parts of the country? Or why do you think?
Why do I think? Yeah, so I don't know. I haven't done a scientific study on this. But one of the things that is really, what I would surmise based on what I do know is that it may be a combination of things. It may be exposure, like in particular communities. To what degree do people have exposure to older people? So one of the things that we know generally is when we have exposure and interaction with people who are, quote, not like us, our us versus them kind of decreases then. So I think in communities where there is more opportunities for intergenerational connection and less age segregation, there is also likely to be less ageism. There was also a really interesting study that was done during this period of COVID-19 and it was out of the University of Virginia, I believe, and that was fascinating. And it was basically communities that had large, they had been frontier communities 100 years ago. But with that history of frontier and roll up your sleeves and we're doing things for ourselves, had a much higher degree of individualism and much less willingness to come together and say, how do we collectively, come together? How do we all wear masks and deal with COVID-19 and look at public health responses? And they had more us versus them. So I'm not sure that's directly on point to why more ageism, but we do know that intergenerational exposure kind of reduces that. Excuse me, my daughter's cat just jumped into the room. I thought I had locked her out. Jezebel, stop that. Okay. If you hear crackling sounds, the cat has made its way into the room. I apologize. All right. So, and if anybody else has thoughts, I love that question. I'm actually going to explore it more. And I'm going to, so let's hold that thought because I actually want to talk a little bit more about ageism. Okay, so what do we want to avoid? So generally, what we want to avoid is the kind of language and messages that reinforce the negative stereotypes that people already have. So my next slide is going to share with you some of the framework's research. And Rachel, if I can ask you to unmute yourself again.
Yes.
And because I want you to look back in the chat and maybe just read aloud when we ask people to put 2 words about what the general public thinks. If you could go ahead and take a look at that and maybe share some of those words.
Yeah, in general, a lot of it was fairly negative, non-essential, too many, burdensome, not valued, invisible, free babysitting, which is interesting. Like thinking about how people can still contribute.
Right.
Overwhelming, costly, time consuming.
Okay. Yeah. So, so you were probably the people interviewed by Frameworks. Frameworks did these extensive qualitative interviews, right? And what they found was what they call, and the reason we have this lovely little picture of a swamp on the left-hand side is because Frameworks calls this the swamp of aging. This has no political connotation. Instead, what it represents is the kind of themes that are in our minds or the minds of the general public that interfere with the kind of messages that many of us who are in this session today are trying to advance. So we may be trying to advance, for example, what we really need is age-friendly public health system. And people are like, no, that's just those old people, right? Because of all of the things. So it's the kind of things that interfere with people's receptivity to very reasonable messages that we think we're putting out there. And so one of the biggest thing that we need to avoid are messages that trigger the swamp. Here are the elements of the swamp that Frameworks found. First, a very big theme of the idealized version of aging versus the perceived reality. The idealized is what I call the pharmaceutical ad version, right? It's sort of, here I am on the beach, I'm holding my glass of champagne, I'm looking at the sunset, life is lovely. I've got this earned leisure and retirement. However, So that's kind of one part of it, but that gets superseded by what is the perceived reality of aging and getting older, which is all of those words that what you've shared. It's a time of decline, dependence, you're a burden on society, you're not willing to learn, etc. So it's basically all negative. The perceived reality of what it is like to age in America is that it is generally negative and it is literally all downhill. And I want you to remember those terms, all downhill, because we're going to be using a message to counter that. The second is a very strong theme of us versus them, right? So for example, people saying, well, you know what, and a friend of mine said this to me, Janine, I love that stuff that you're doing about, aging and ageism, but really if we stay in the workplace as we are older, aren't we taking jobs away from younger people? So classic example of us versus them. Now, what we know with respect to that particular statement is it's factually not correct. It's something called the lump of labor theory. It's kind of the same kind of argument that is sometimes used against immigrants. Immigrants are taking, quote, American jobs. And we know that that's not true. Actually, the more older people stay in the workplace, the more economic activity there is, and the more opportunities that actually creates for younger people. So it's been disputed and refuted by economists, but it's still prevalent. There's a very strong theme of individualism, right? Individualism attributes, if an older person is not doing well as we age, it's kind of our fault. We didn't eat well enough. We didn't exercise, we didn't save enough money, etc. So there's no recognition of how social determinants of health, how our environment might play into that, how ageism might play into that. There's not a recognition that for some people, if you have experienced a lifespan of systemic health inequities and discrimination, of course you are going to have worse negative health outcomes, right? But so it ignores our environment. It ignores factors, for example, that women are much more likely to be worse off financially as they get older, because we are more likely to have stepped out of the workforce, to have children, to step out of the workforce, primarily to care for older family members. And we've probably been paid that 72 cents on a dollar throughout our lifespan. And of course, if you're a woman of color, you're even worse off. But that's the theme of individualism and how it plays out. There's a strong theme of nostalgia and threat of modernity. Nostalgia sounds like, in the good old days, Social Security was solvent. In the good old days, the kids took care of grandma. So all of that kind of prevents people from being forward thinking about, okay, so demographic pyramid has changed. We've moved from pyramid to barrel. How does it need to look differently now, because we get stuck in the past? And finally, and I think the most dangerous of all of this, and why it's so important for all of us to always be talking about the solutions that we've got in our back pocket, is when the general public was asked by frameworks, so what kind of things should we be doing? People either came up with very individualistic solutions. So, well, older people should just save more money, or education. And I say this as someone who served on the Denver Commission on Aging for 4 years. And we always had a resource fair and we always had resource guide. But at some point we needed to step back and saying, educating people, here are the agencies, when we don't have underlying services or we don't underlying housing in and of itself isn't enough. We need to look at some policy solutions, right? And finally, the most dangerous kind of thinking about solutions is probably fatalism, or that sense that nothing can be done. And when people believe that nothing can be done, they do nothing, right? So all of us as aging advocates are out there saying we must do things, and people are like, it's too big a problem. There are just too many old people. It's too tough. So that's what we are communicating into. Let's look at some examples of how this kind of has played out and is playing out in COVID-19. So ideal versus perceived real is really obvious. Every day, and I think every community across the US, there is a public health official or or elected officials who are saying, we must take all the steps we can to protect our weak, vulnerable elderly. Us versus them, that whole older people versus the economy argument that has been prevalent in many communities and in national discourse. And then individualism, and this was, the somewhat shocking statement that was made by the US Surgeon General. So some of you may recall when the evidence started to mount that health outcomes for people of color, especially Black and Brown communities, were more negative, not only in the outcomes, but also mortality rates among COVID-19, it was attributed to people's choices instead of looking at systemic health disparities. And the Surgeon General said, well, you know, those people need to stop using, you know, drugs and alcohol and smoking as much. So those are just examples of how embedded that is in people's thinking. And so it affects our ability to move forward. So what we want to do is avoid that. And so this means this is language that Frameworks recommends that we need to move away from. So first, the first bullet was a recommendation even before COVID-19. So Frameworks Institute did some testing on the words elderly, senior, and senior citizen. And they also tested older people and older adult. And what they found was that the terms elderly, senior, and senior citizen actually conjure up all of those negative stereotypes, whereas the terms older person or older adult are perceived as more neutral and don't bring up all of those stereotypes. My recommendation is what's best is if you're describing your program, a population that you work with, the best is to simply be specific about age level. So it might be our Silver Sneakers program is for people age 55 and over, whatever it is, but being specific about the age level that you're targeting. But if you don't want to do that, you might older people, older adult, etc. Knowing, and one of the things that I think has been really significant, and this goes to the many voices one choir, because of the success of the Reframing Aging movement, the American Medical Association, American Psychological Association, and just this year, this spring, Associated Press now recommend in all of their style guides to not use the terms elderly, senior, and senior citizen. So that was kind of a huge win for the Reframing movement. Item number 2, and this is very COVID-19 specific. To avoid the terms weak and vulnerable, and instead to talk about people with greater risk factors. Weak and vulnerable, so what it does is it brings all those stereotypes and it doesn't allow people kind of the nuanced thinking that, or the understanding that I know all of you on this call have, that the older adult population, one, spans a large number of years, right? And we also know, and any of you who are gerontologists here know that, you know, as we get older, we actually get more different from each other, not more the same. And so there's a lot of variety. With the consistent term of weak and vulnerable, what has happened is that basically anybody older has been cast, quote, into this category. But the other reason that Frameworks recommends moving away from it is they had tested the term vulnerable actually with the Children's Mental Health Initiative. And vulnerable actually, and this may be counterintuitive, reinforces that otherizing. There are all of us, and then there are those people, the vulnerable people. And the use of the term vulnerable actually resulted in a decrease of support for the kind of programs that were needed for, quote, vulnerable children needing children's mental health issues. So better again to be very specific about when we're talking about COVID-19, to talk about, you know, here are groups of people who have greater risk factors, and then maybe name those risk factors instead of casting a whole group of people as being weak and vulnerable. And then finally, and I think this, you know, I put together this slide before colleges had reopened across the United States, but I think we're really seeing that, you know, it's a congregate living that has a really negative impact on the surge in COVID cases. And so the recommendation is instead of nursing home residents, which again makes the issue of COVID-19 seem something that is specific to older people and people with disabilities, is instead to talk about people in congregate living are at greater risk. So whether that is long-term care facilities or immigrant detention centers or meatpacking plants, or now we know college dorms, we should, when we are talking about COVID-19 and risk factors, talking about people in congregate living. There are messages that we want to move away from during this time. So we have always wanted to move away from us versus them. That's been a basic principle of reframing aging. We gain no public support for older adult issues when we simply say older adults need this, and we kind of create us versus them. So It's especially, though, important now because of the degree of us versus them taking place. And so instead, the recommendation is we need to talk about our need for interconnectedness. If we are going to solve what is essentially a public health problem, we need to think about how we are all connected to each other. So, for example, a kindergarten is open, but the kindergarten child is going home and staying with grandma who's taking care of child after school while mom is working. That it's not like we are in these age segregated bubbles. So we need to talk about the need for interconnectedness as we are talking about COVID-19 and the kind of policy solutions that we need. There's been a lot of sacrifice messages, and this one's a little tricky, so let me just spend a minute with it. Part of the sacrifice messages, I think, are in our attempt to honor frontline workers in healthcare, essential workers, many of the work that you do. Some of you are probably considering yourselves essential workers as frontline workers. But when we use the language of sacrifice, so this group of workers, the healthcare providers, the long-term care providers, the people who are showing up in our nursing homes, the people who are showing up at the grocery stores, and how they are sacrificing, basically what happens is, again, it creates that otherizing us versus them. And who are we sacrificing for? We are sacrificing for the weak, vulnerable, elderly, right? That's how the narrative plays out. And that narrative doesn't get us, one, it's not a good public health message. But secondly, it doesn't get us to our goals because it just otherizes older people, and it conjures up the negative stereotypes, and it makes people, it kind of triggers that, well, why don't the older people just go away and sacrifice themselves, right? So what's really important is to talk about our common goals. And I think two common goals that we all want. We want our communities to be healthy, right? And we all want our economies to reopen because we know the danger, right, that we're all in. So if we can lead with those as common goals, and then we can say, so what are things that need to happen to make that happen? So important to message that way. And then we need to avoid crisis. Now, this is also going to sound ridiculous because you're all going to be thinking, well, we're in a crisis. How can I avoid crisis messages? But the takeaway is to avoid crisis message without explanation. We have to explain how our problem works, and we have to talk about specific solutions. And when I say specific, we need to have enough specificity that people can understand and say, oh, that's how that works. And that requires us, because many of you on the call are experts in your various fields. You know how it works, so you don't, you shortcut, right? You don't feel the need to explain, but it's incumbent on all of us to explain how something works so that people understand. I'm going to give a few examples now of how to avoid and examples of what to say instead. So this first example is one that myself, as supposedly a reframing expert, aging expert, I did the avoid example. When Colorado's crisis standard of care came out and I read all 26 pages, I was like immediately on the phone call, on email, saying what is in this statement. These crisis standards of care are ageist, and they are going to move older people and people of color to the back of the triage lines. In my mind, a true statement, but there's no explanation. The better, and what we are now saying, is we're explaining how this works, because people were like, well, these were put together by a group of professionals and they're well-meaning, ethical people. Of course they are. But what we have to do is we have to explain how this works. So what we are now saying is the current crisis standards of care have a scoring index that assign higher scores as you get older, and also scores for comorbidities that are more frequently found among people of color. Now, the goal in crisis standards of care, the way you get the ICU bed is you get a low score, right? So high scoring in this case is not a good thing. It's not like school. By removing, and then we explain what you can do about it, right? We're explaining why we consider it ageist, but then we're also explaining what you can do about it. By removing that scoring index and using systems like other states have adopted, we can treat everyone more fairly as they seek emergency care. So that's example number one. Example number two, and there were, a lot of conversations, certainly during COVID-19, about what physical distancing and what was called social distancing. We prefer the term, and I know many of you do too. It's physical distancing, and we continue to talk about how can we maintain social connection while we are physically distanced, right? But what we want to avoid are statements that simply say, with social distancing in place, vulnerable seniors without technology are lonely and isolated. That may be factually correct, but it's not hopeful. And it just creates that, it creates us versus them. And then it doesn't let anybody know what can we do about it. So what we can advance instead is, in our community, we care about opportunity for everyone. So we're doing that. We're all in this together. We're leading with this all in this together value. We care about opportunity for everyone. Now comes our explanation piece. Right now, because of digital divides, some people are having a harder time than others accessing healthcare, online services, and K-12 education. So we're broadening it. It's not us older people versus them younger people. It's not just a problem for older people. It's really a system policy digital divide issue. And so we're explaining that. And then we're providing a solution, which, one of your local solutions. We can close the digital divide with solutions like PCs for people and related programs. This is where you insert kind of whatever programs that you're doing when you're doing an explanation. But that's an example of, if we simply say, this is a problem, not helpful. If we can explain what it is, broaden it so it's not just a problem of older people, it's a problem that it's a system problem. It's a problem, a policy problem. We have a digital divide, but then we provide a solution. That's kind of how we make this narrative work. So now I want to talk about, okay, so we've kind of gotten a preview of what to avoid. What do we want to advance instead? And to advance, what we really need to do is we need to tell a story, and the story that we're telling is basically, it has two elements to it that are tested. Now, there may be many other stories and other stories you're telling, but there are two tested narratives. And the fundamental premise of the tested narrative is it moves people away from us versus them. It moves people away from older people are a problem, and it asserts two things. Our different stories say, one, older people are a valuable resource to our communities, to our workforce, our economy, their families, etc. So older people is resource, think about that. And then the second story is that ageism is wrong, it's unjust, and we must do something about it. Before we get into the structure of those two narratives though, telling a different story means telling a system story. So many of us are used to, right? We learned storytelling. And if anybody, my background was in both strategic planning and fundraising before I came to changing the narrative. And so my formula for funders on the call, forgive me, was tell sad story about older person and then say basically send money, right? And we need to move away from those individualistic stories and the sad senior stories, because basically they, oh, Rachel, thank you for clapping. We want to move away from those sad stories because, one, they conjure up the stereotype, but they don't conjure up hope, and they don't conjure up that sense of efficacy that we could do something. So we want to move away from individualistic episodic stories, and instead we want to tell what Frameworks Institute calls thematic stories. We are telling the story about how an issue works. So with that, we are, and I'm going to reassert here, part of our stories have always got to explain how the problem works and why it exists. So systemic, not individual. So, and I'll give you an example. If I tell a sad senior story of, and these are stories, and we all know that they're going on right now, right? If I tell the story and I say, Emma lives in Denver. We already had a gentrification and a housing crisis and an affordable housing crisis in Denver before COVID-19. Now, Emma has not been able to hold on to her $15 an hour job, and she was sent home because she is over age 65, and the employer doesn't want her in the workforce. So Emma is now going to be evicted. So that's a story about Emma. And it's sad, but then you're like, now what? What do I do? So what we've got to describe instead is we already have an affordable housing crisis. We need to think about new housing solutions. We need to think about solutions like home sharing. And by the way, maybe we could put a pause on evictions. So we want to think about what the system is, and we want to talk about what the system is. And we want to put together either policy solutions or potentially programmatic solutions that you might be running in your organizations, like home sharing or something. And we need to explain what those actions can do. This is what is called, so what I've just explained is what frameworks would call, and I want you to have the formal language, a social issue narrative. So a social issue narrative is what we use. It's basically another way of saying we're telling a story, but what it does is it increases people's understanding of how an issue works. It actually shifts their opinions about how, so instead of blaming the individual and becoming highly individualistic, they start thinking about, okay, so what can we as a community do? And it helps build support for the kind of solutions that many of you are implementing in your communities. The structure of a social issue leads with a value and a tested value, right? So many of us have our own personal values. We probably have organizational values that when we were going into the office hung in the lobby or that kind of thing. But these are the tested values that I'll share with you. And values basically get people to think about, why should I care about this? Why does this matter? The second goes back to this idea of explanation. So we lead with the value. We need to explain how an issue works. And sometimes it's simply an explanation and with some examples. And sometimes it's the use of a metaphor that help people kind of understand, oh, it's like that. And then finally, we are always, always ending with a solution. It gives people hope, a sense of efficacy. We can do something about this. We are doers. And our solutions can't just be, well, we've got to do something about housing. They've got to be concrete. They've got to be collective solutions. The solution should not be, well, Emma should have just saved more money and then she could have continued to pay her rent. That's not useful, right, at this point. We need to have collective solutions. Credible, meaning that they are solutions that don't have a financial self-interest. And we have to have enough detail in them that people can see how they work. And that's what we mean by conceivable. So as I mentioned before, there were two social issue narratives. So frameworks actually tested a number of narratives to see what would lead to those outcomes that we talked about at the beginning about changed attitudes, increased support for public policy, and decreased ageism. And there were two that actually have that effect. And one of them, you don't have to call it that, but frameworks calls it embracing the dynamic. But the basic story that is being advanced here is older adults have value, right? Our value actually increases with age. It doesn't dissipate with age. And that the aging of America is not a problem to be solved. It's actually an opportunity, right? It's an opportunity if we look at it the right way. So that's a way that we talk about this demographic change. And the second is talking about ageism. The storyline that frameworks uses is confronting injustice, but it basically is a story that ageism is unjust. And because we are more likely to use the ageism is unjust narrative during COVID-19, I'm actually going to lead with that one. So we want to, in the terms confronting injustice are really important because one of the things that frameworks found was that many of the national leading organizations who were in the forefront of talking about ageism we're using terms like ageism is the next civil rights battle and it's the last civil rights battle. Well, of course, if we look at what is going on in the world now, we know that there's a lot of injustice to go around. We have not solved civil rights and certainly social justice and racial justice issues. So that kind of framing is counterproductive. And also when ageism was described as a civil rights issue, people who had experienced racism and sexism had said it can't possibly be as bad as that, was another outcome. And then the third outcome was it led people to think really narrowly, well, somebody, if they're being discriminated, just needs to go ahead and file a complaint with the Equal Employment Opportunity Commission, instead of, stepping back and asking questions and saying, well, why in the state do we allow employers to ask people for high school graduation dates? Because we know that it's illegal to ask someone's age, but it's not illegal in most states to ask someone the high school graduation dates, although we're making an effort to change that in Colorado. So, but those are why we want to talk about ageism as it's a matter of justice, social justice, and confront injustice. So what we do, remember we lead with a value, we've got that kind of a narrative arc, and the value that we're leading with is justice. I personally believe that it is very important, especially in these times, to describe justice it's an aspirational value that we have for the country, to recognize that we haven't achieved it yet, but it's aspirational. It's something that we believe in, and that justice requires recognizing that not all members are equal. We need to talk about how our society is not treating older people as equal, and if we want to live up to this ideal, we have to confront the injustice of ageism. Now, there's a lot of, unlike the previous slides, there's a lot of text on these slides. You will be getting all of them. And unlike school, where plagiarism was wrong, here, lift whatever language you want. And the reason for that is, remember, go back to that slide, many voices, one choir. The more that we are using similar language in describing the work we do and the issues that we're dealing with in similar language, the better off we are, because we are then creating that one choir that when media and other policymakers in your communities are listening to all of you on this session, when they're listening to all of you, they'll be saying, huh, I've kind of heard the same thing. That must be the thing. So feel free to use this. Then we need to explain ageism and what its effects are, because what Frameworks found is most people don't know what ageism is, so it's important. So we go back to that World Health Organization definition, and we say ageism is prejudice, stereotypes, discrimination based on age. We list some of those negative impacts that you saw earlier in the slide. Not only does it have negative impact on older people ourselves, or maybe the older people that you serve, but it also really has negative impacts on our economy. And we have found in Colorado that when we talk about the economic impacts of ageism with policymakers, especially now with reduced budgets, we're getting some traction in that. So I'd encourage you to think about that as well. Frameworks found, even though the ageism takes place in a lot of spheres, including healthcare, et cetera, that using workplace discrimination as an example when you're talking about what ageism is very effective. And the reason it's effective is that many people feel that either they themselves or someone they know has experienced workplace discrimination. It may not have been based on age, it may be based on gender, race, LGBTQ status, but whatever, for whatever reason, people understand what workplace discrimination is. So it's an effective way by giving an example of workplace discrimination. The second part of explanation is explaining implicit bias and letting people know that, you know, it's because of the messages we're surrounded with from the time we're kids. We form these negative biases about older people and about aging, right? But we know that simply being aware of these biases kind of stops them in their track, and it makes people less likely to act on them and treat people fairly. And there's a lot of research into this in the world of work as well. For example, when HR managers are trained on implicit bias, they are more likely to treat older applicants fairly. And then we've got to give some solutions. So I'm going to give some workplace example solutions and some healthcare solutions. Workplace. Some examples of concrete systemic solutions are eliminating graduation dates, from high school graduation dates and other age identifiers from applications. We can train managers on implicit bias because, again, when we do that, they're less likely to act on it. We can establish better rules and systems for hiring. So instead of allowing people to make judgments about what they think they're seeing on an application, we can do what is called skill-based hiring, of determining whether someone actually has the skill. One of the things that we do a lot in Changing the Narrative, we've got a separate, and part of our initiative is called the Age-Friendly Workplace Initiative, and we educate employers and workforce centers about the business case, why it makes good sense to hire older workers and to have intergenerational workplaces. And we can strengthen age discrimination law. You know, the American Society on Aging in the last year put out one of their publications, and one of the articles showed that states that have stronger age discrimination laws actually have, surprisingly, less age discrimination. So putting forward some really concrete solutions. Here are some solutions in health. So we know those negative impacts of age discrimination in health. But so some effective ways, some effective solutions are training people who work in healthcare on implicit bias and ageism, including older people in clinical trials. So I think many of you know that very often the treatments that are prescribed for us as older people have not been tested on older people. And that was kind of certainly true in some of the early clinical trials, even for COVID-19. Exposing students to older adults during their professional training. Again, that sort of exposure to other groups is always helpful. Including older adults in health equity discussions. And then eliminating age and comorbidities as scoring criteria for triage decisions. So again, not an exhaustive list, but some examples of if we are out there talking about age discrimination in healthcare, we need to put forward some explicit solutions. So now we're going to talk about increased longevity, and then we will go to your question. So the narrative here is called embracing the dynamic. And what we mean by embracing the dynamic is, instead of viewing increased longevity and a lot of older people as a problem to be solved, we're going to embrace this. This is an opportunity. How do we think about it? We lead with the value of ingenuity, innovation. We kind of, what frameworks found when they tested this value is that, in general, people who live in the US like to think of themselves as problem solvers. We see an opportunity, we figure out how to see it. If we see something that isn't working, we rethink our approach. And so we want to conjure up with people, this is the way we think about things, right? We think outside the box. This is who we are, and we need to think differently from this older people are a burden to what are the opportunities that are provided by the fact of the aging in our state in America. And here's an example that I love. And this is how simple, right, that you can use, and then you just insert your own local examples. So you could simply say, let's use our ingenuity to reimagine how our communities can use the talents of older adults to help us address the pandemic. What I love about this particular example is this is a group of people from a Quaker community in Denver. When the stay-at-home order was issued, churches, faith communities were shut down. They said, well, we've got this, vacant Friends Meeting House. And so within a week, these were people, and the one in the upper left-hand corner is a colleague of mine from the Denver Commission on Aging. They basically retrofitted the Friends Meeting House so that frontline responders who were going into hospitals and dealing with COVID-19 on the front lines didn't have to go home to their families between shifts, but would have basically a place to stay overnight, etc. So a great example of older people coming together, coming up with a solution, and then simply making it happen. The middle part of our narrative, our explanation is, and remember I asked you earlier to recall that idea that the general public has that everything is going downhill. So the metaphor that we're using instead is, no, you know what, we're not going downhill. As we get older, we are building momentum. And it's uphill instead. If you think about, and I'll ask each of you to just pause and think for a moment, of something that you probably know this year that you didn't know a year ago, however painfully learned, and think of how we accumulate that over time, right? So what we want to talk about instead of getting older is a process of decline, deterioration, going downhill, getting older is a dynamic process. It involves continuous change. We gain momentum through the buildup of experience and insights. And if we don't allow ageism to get in the way, this can actually move our communities forward. And so we should do all we can to support it and make the most of it. So again, you can use these words or you can make them your own. But the idea is, as we get older, we build, we kind of learn a few things. It always reminds me of that farmer's insurance ad, right? We know a few things because we've done a few things. It's kind of like that. We've built up. And this can be an asset to communities. That's the big takeaway to remind. And here's an example. So this is the woman in the blue is my friend who just turned 65 2 weeks ago, Councilwoman Debbie Ortega. And so she, we're all doing the stay at home. A bunch of people in the community, in this case, mostly immigrant women, are suddenly unemployed. And so she goes to a pastor of a local church and says, you've got this big open room. I want to make masks. So she basically, because of the network connections she's built up over a lifetime of political and community involvement, she gets sewing machines donated, whatever cuts fabric donated, tons of fabric donated. And this, the Colorado Sewing Coalition referenced here has already produced 30,000 masks that go to PPE, to nursing homes, long-term providers that weren't prioritized. And meanwhile, she's been able to pay women who are unemployed. So an example of, because of her insights and connections built over time, she was able to put this together. And then finally, we want to put together kind of solutions. So I gave some very specific examples. One of the things that Frameworks found is solutions that involve anything intergenerational are very effective in communicating the benefits of older adults. So it might be intergenerational tutoring programs, now mostly being carried on remotely, certainly, intergenerational mentoring in the workplace, etc. But those kind of solutions, especially those that involve intergenerational, are effective in getting people to think differently. So I actually am going to come back to questions. You're going to have an opportunity to ask questions because I want to share with you, here are resources and tools that you are going to get. We're going to be sending you, or we, our friends who put on this conference are going to be sending you a PDF of this presentation, a Reframing Aging checklist. So some of the stuff we've talked about here, you'll have a checklist if you want to check your own communications. We'll be sending you quick start guides, and quick start guides are basically one-page cheat sheets to reframing aging and reframing COVID-19. And I'm also going to send you just some additional slides. So this is kind of a compressed version of a half-day workshop, and I want everybody to have the full thing, so you'll get some additional slides as well. And then kind of a link if you're interested in becoming part of the movement to end ageism. You can join us. So Rachel, I think we're going to take questions now, correct?
Yes, awesome. So we had a couple of questions earlier, and I'll lump them together a little bit. They spoke to understanding that some older adults actually feel like they've earned the term senior, and they think, you know, what's wrong with that, that it's very much individualized, that they don't mind, you know, a specific label. And then somebody else also asked about how we move and advance our conversations about aging and ageism, that the responses you gave, the ways to elevate that conversation, were a little longer. And that there's such a demand right now for short, sweet, pithy. We're in a Twitter limited attention span world. Yeah. So how do we maybe one, respect people's individual, I would like to be called this, and then also how do we elevate that conversation while also being succinct?
Okay, so I'm going to actually take those as two questions. So, I mean, they're all of these are related, right? But I'm going to take them too. So first, with the term senior. So, and I want to separate out how you might talk to an individual as opposed to what you do in your public communications when you're developing your website, your brochures, giving speeches, etc. So if, you know, my rule has always been, and I grew up in a French-Canadian family where the grandmothers were Memaid. And if Memaid wants to be called Memaid, you just call her Memaid. You're not like, no, Memaid, I'm calling you an older adult, right? We're not doing that. If an individual person wants to be referred to the term senior, fine. We're not talking about how people individually want to be referred to. We are talking about trying to be that one choir that collectively doesn't want to be putting out, think of it as the discordant note. If a bunch of us are trying to advance the idea that older adults, valuable resource to community, and we know the research shows that the terms senior citizens, senior, and elderly actually counter what we're trying to put out. We don't want to be the one that's, you know, singing the wrong note in the choir. You know, if we're in our house and the person who wants to be called senior is across the table from us, we can call that person whatever, you know, he, she, they want. But what we're doing here is in our public discourse, we're trying to sing on tune. Repeat the second question, because I feel actually that was three. As you were talking about, Rachel, I felt that was three questions, but can you repeat it for me?
Yeah, so the last question, or the other question was that we're in a very like Twitter attention sphere world, and that the examples you gave on elevating our aging conversation were longer. So how do we still elevate our conversation around aging while also maybe still being short, sweet, and attention grabbing?
Yeah, so I think that there are a couple of things, and one of the things we're actually, and I will let you all know, I'm actually developing it will be a webinar, I'm not doing it in person, a webinar on kind of reframing aging in social media and how we do it kind of in those like short snippets, right? Because so there were a couple of things that we can do to deal with the short. in all of our communications, we're not giving the long explanation, but we can give, whether it's a tweet or a Facebook post, we make sure that the underlying communication that we're giving a link to has those elements in it, and then we're putting some short, pithy statements. And I think actually I've shared here our Facebook Change Narrative CO. If you look there, you'll see a lot of examples, because we do a lot on social media, and we try to do the short snippet, but then we have links to the longer explanation. Part of this, so there's, that level of communication. Part of it is also visual, and we didn't talk about visual communications here. We did a photo contest last year, and let me add that to the link that I will send. I'll send it to all of you. We did a photo contest because so many of the visuals of older people are either that idealized, right? We're silly and we're on the beach and we're acting ridiculous and we've got the big red glasses, right? And we're, with bubbly drinks and little umbrellas, or we are very sad and we're looking out the window, right? So to counter that, we did what we called a real photo contest, and there are 18 photos. It's just a start. There are 18 photos living on Next 50 Initiative's website that we awarded because it showed like real life older people at work, volunteering in community, starting businesses, the kind of things that many of us do, right? So I think we need to be mindful, because we all know a picture is worth 1,000 words. And when we're doing those short communications, we tend to use visuals. We all know that it's really hard to get visuals of that are positive visuals of older people. So we are starting to do that, and we're trying to build a photo bank around that. So I think being mindful of that.
Janine, would you go to the next slide, please?
Yeah.
And are you willing to stick around until noon?
Yes,
okay.
Absolutely.
All right. So we want to just acknowledge, thank you all for attending, and also wanted to thank our sponsors. We'll continue and we'll keep answering questions. But if you do need to leave, thank you so much for coming, and look for an email with a link to the participant evaluation immediately following this session. And as Janine mentioned, if you or your organization is interested in participating in that advanced Reframing Aging workshop, please indicate that on the participant evaluation. And Janine, would you go to the next slide as well?
There you go.
So we won't read off everybody, but we want to thank all of our sponsors as well who helped put this on. And all of their logos are listed here. So thank you so much for everyone. And we'll be announcing a date for the 2021 Age Positive Conference as early as next spring. So if you do need to leave, thank you. Enjoy the rest of your day. And if you would like to stay and continue our Q&A, we will keep doing that.
Yeah. And I also, if you put questions in the chat, I've told conference organizers ahead of time that I'll go ahead and just prepare some responses and send them out with the rest. So I'm actually going to stop sharing because I would love to see who's on. Is that all right, Rachel?
That sounds great.
Okay. Yay. All right.
So
I love gallery views.
One other question that just came in, that some of the worst offenders of prejudice, stereotyping, and discrimination against older adults are themselves. So what is the way to address that? Yeah,
so I have a couple of theories about it, but my strongest theory, and I'm sticking to it, is of course we are, because we've been exposed to ageism longer. If from, I'm 67, or from the time I've been hearing since, I'm 2 or 3, that, oh, getting older is bad. And then especially I think for women, getting older and, God forbid you have a wrinkle, like, you're just out of there. So one of the things that we're doing is sharing a program, and we call it Ending Ageism Together. So it's not for aging advocates, it's not for people like you in the room, but it's kind of, if any of you, back in the day participated in feminist consciousness raising, it's basically like an hour program. And I can send a link to the next time we're doing one publicly, but it shares information about ageism. It talks about why are we ageist, but the more we've done it with a lot of programs at centers and programs that serve older adults, because they've said the same thing that you're all saying. And what we've discovered is, when people start talking about it, I mean, I've had this conversation with my husband, like, here I am leading an anti-ageism initiative, and he's running around saying, I'm having a senior moment. And I'm like, Vanderburg, when we were in our 20s and we were first married, you lost your car keys. It isn't a senior moment thing. It's a Vanderburg thing, right? Like, let's just, so, but we internalize that stuff, right? So I think the program that we do is called Ending Ageism Together. Ashton Applewhite has some good stuff on the This Chair Rocks, some questions that you can ask, but it's basically getting older people together and talking about, like, why do we do this? And then we've got the other thing, I've got so much stuff to send you all. The other thing we've got is kind of like a toolkit, and part of it is showing some little videos that like AARP has put together. One of them, I don't know if any of you have seen it, it's called, it's only 3 minutes, and it's called You Look Good for Your Age, right? And so many of us think, oh, that's such a great compliment, right? If somebody tells us we look good for our age, but it goes through is that really a compliment? And that's a great segue. You know, you show that in a group of people and say, why do we think that's a compliment? You know, and then, and there are just some really funny things because it's a very diverse group of people in, and then people are reading these things. And, you know, one of them says, there's actually a young Asian woman who's reading, oh, you're funny for an Asian. You know, I mean, it's sort of things we know we would never say, but we consider it great to say you would look good for your age. So that's how we're dealing with it.
Yeah.
Other questions?
There was a question previously on the topic of employers, and was curious, how have you succeeded in gaining the attention of employers who are reluctant to consider the issue of keeping or hiring older employees?
Okay, so this is my soapbox. Y'all are going to have to stay on for another hour. No, I'll do my short version, and then we can send some more resources. So what we did, and we did this at the beginning of 2019, and the reason, and I'll go to, it's a little bit of a complicated answer why we did it. This was not our intent when we started changing the narrative. We were not going to be talking to employers. In 2018, I was traveling around the state of Colorado doing the long version of this workshop in person, and I was also, you know, doing some of these around the country. And I did 42 workshops that year, the year we started. Every single workshop, there was someone who came up to me during the workshop, after the workshop, emailed me after and said, that ageism and workplace thing happened to me, happened to my partner, happened to my dad, right? Younger people are worried about this happening to their parents and grandparents. So I went back to my funders who were amazing, and I said, we need to be talking to employers. We're talking to you know, in a way, we're talking to the choir here, right? We all care about these issues, but we need to talk to people who are discriminating. So we were very thoughtful about it. We got a group of people, including HR people, et cetera. And we said, we mapped what are all the stereotypes about older workers? And then we pulled the research, what's the reality, right? And so most of the myths, I'll send you as well the business case briefing. All of you are going to be overloaded with a follow-up email. And we turned it into a business case briefing, which talks about, one, the demographic shift. It's a matter of business necessity for not all employers understand the demographic shift, but it's a matter of business necessity for employers to deal with it. We refute the myths. Then we talked about the benefits, and there are some real research benefits about the benefits of intergenerational workplaces and intergenerational mentoring. So we put it all in a business case. We went to a presentation. Now I get to where we answer your question. We started with chambers because individual employers didn't want to talk to us, but we basically pitched every chamber in the Denver metro area, and we said, you know, you're always looking for lunch and learns. We've got a topic. We went and we started talking, and it was interesting. After the first 3 or 4, momentum built up on that. Last year, before COVID-19, we had done presentations to 29 chambers, reached 900 businesses and civic leaders. 87% of them said they were more likely to hire older people as a result. And people started emailing us, where do I find these older workers? So that is the project that we were working on when COVID-19 slammed it shut. So that is one of how do we make sure that the older workers are connected with the employers who now see the value. Does that answer the person who asked the question? Yeah.
And I want to mention too, locally, we have a young mayor in Kansas City, and the mayor's office actually created an internship for older adults, and it was almost like a second act. So
I love that. Yeah.
It was so exciting to see. Yeah. And I think all of us, especially those of us in Kansas City, need to make sure we tell the mayor's office how much that means to us, and that that's something that we like to see here in our city.
Well, and that's the kind of thing, honestly. So, you know, another thing that we do on our blog to communicate, and this goes to the how do you tell a longer story. We've just done these series of stories about older people kind of giving back to community, doing a variety of things. They're all on our blog, but we like to highlight stories of people like your mayor who are doing cool stuff like that. So introduce me to your mayor, we'll blog on him. I mean, no, we want to elevate, like, here are people who are doing the right thing, right? This is cool. This is, you know, and we've done stories of people outside of Colorado as well, because there are, I feel like part of this choir is when people are doing the right thing, we are there cheering and, you know, we just cheered our governor because they put a new talent pipeline report and they actually included age for the first time as an element of diversity, equity, inclusion. So we were all over social media going, woohoo, you know. Yeah.
I think we hit most of the questions. Any other final questions before we close our 2020 Age Positive Conference? All right. Well, this session concludes the 2020 Age Positive Revision Conference. We hope you enjoyed all of these sessions and found at least one new program or idea to incorporate in the programming or work that you do with older adults. So thank you, everyone. Janine, thank you so much for your insight and expertise. Again, look for an email with a link to a participant evaluation survey. And make sure that you indicate if you're interested in participating in an advanced reframing aging workshop.
Thank you all so much. Thank you. I was so looking forward to seeing you in Kansas City, which I love, but maybe you'll invite me next year. Anyway, thank you.
Thank you so much, everyone. Have a great rest of your day.
Have a lovely weekend, everyone.